Hey there, Dr. J here. And so I have, as promised, this practice picture quiz. And so if you've watched my mini course on YouTube, you've seen an introduction to the terms, an overview of the various parts of the skeletal system, including the upper limb, the lower limb, and the axial skeleton. And so for all the details, of course, go over to my website. But for this quiz, what you want to do is you want to take a look at the PDF on my website so you can go ahead and just practice. Try to answer the labels or answer what is labeled on each bone and try to remember some facts and details about the bones. And then that's what I'm going to do on this particular video is I'm just going to roll video here. We're going to stop on a label. You can tell me the name of the bone and then some facts and details related to the bone. Of course, you're not telling me directly, but you can tell me via the camera wherever you're sitting watching this video. So what is the bone or part of the bone that is labeled? And can you remember any facts, details related to the bone or part of the bone? And again, pause me if you want. Go over to that to my website and find that PDF and practice before you hit this video. So number one, what is labeled there? So that is labeling the body. In this case, this is a thoracic vertebra. So the body is the anterior aspect of the vertebra, and then the posterior aspect of the spine, located toward the top of this particular image. And then in my course, I also talk about the transverse process, located laterally on either side. And so there are all kinds of components of the vertebra, but we'll start with those there. And again, this is labeling the body of the vertebra. So this is the scapula, and so one prominent feature that you're seeing there is the spine. That's a really good posterior landmark for the scapula. So what's labeled there, those are the metatarsals. So the metatarsals are distal to the tarsal bones, but they are proximal to the phalanges. So this particular arrow is pointing to a lumbar vertebra. So above it we have cervical, then we have thoracic, then lumbar, and then beneath it we have sacrum and coccygeal vertebrae. So this is these are the vertebrae of the lower back, just above the pelvis, just superior to the pelvis. So we have 5 total lumbar vertebrae. So this is actually showing the distal part of the femur, which is the bone of the thigh. This is the patellar surface. So this is a pretty tricky one here. This is where the patella would articulate or connect with the distal part of the femur. What is this showing here? That is actually the humerus, which is the bone of the arm. And so you can actually see the head of the humerus at the top of the image. And then the distal aspects of the humerus include the trochlea and the capitulum, located toward the bottom of the image. The red square is showing us the carpal bones, the most proximal aspect of the wrist/hand. Then distal to those, we'd find metacarpals, and then we have phalanges. So carpal bones, there are actually 8 distinct carpal bones in the wrist. What's there is the pelvis, and specifically we are looking at the acetabulum. There's not a label there, but the cup there. So the hip is the ball and socket joint. This is the socket for the ball and socket joint, and then the ball is the head of the femur. So that big area there that's facing you is the acetabulum, a part of the pelvis. This is the clavicle, commonly known as the collarbone, and we actually have two main components there. We have a sternal portion, and then we have an acromial portion. The sternal portion is on the left part of the clavicle, as you see it there, and then the lateral aspect is the acromial portion. That's the ulna. Specifically, you're looking at the olecranon process, the bulky, funny-looking proximal portion of the ulna. This is the femur, so you see the whole length of the femur. You can see the head of the femur. That's what links up with the acetabulum, which is part of the pelvis again. And we saw that in the previous picture here, previous image. And then at the bottom of the image is the patellar surface, where the patella actually articulates with the distal part of the femur. So now we're taking a look at the red square. I got it this time and nailed it. Is the metacarpals. So the metacarpals are distal to the carpals, but they are proximal to the phalanges. So you're looking here at the proximal aspect of the tibia. So this is the part of the tibia that articulates with the femur. And you can actually see a component called the tibial tuberosity just distal to this portion. So this portion of the tibia is smooth, and these are called condyles, and they allow for a connection with the femoral condyles. And so you have a medial and a lateral condyle here. So again, you're seeing the proximal aspect of the tibia. So here's the skull. You're looking at the skull from a lateral view, and the red square is labeling a facial bone. In this case, we're looking at the mandible, the lower jaw. There's the radius, so you can actually see the disc-like head of the radius, and then just distal to that, you're seeing a part that sticks out a little bit. That is called the radial tuberosity. That's where the biceps brachii attaches. But overall, this is the radius, the lateral bone of the forearm. There's the tibia, and you're taking a look at the tibia from an anterior view. And so the part that you saw in a previous image here was the part toward the top of your image. It's like you basically turn it towards you, and you're looking at it from a top view or superior view. Then at the bottom, you can see the medial malleolus, which is part of the medial distal tibia. There's the fibula. This is the lateral bone of the leg. Now we have an arrow pointing to a cervical vertebra. So again, we have cervical. Then beneath this, or inferior to that, we have thoracic vertebrae, then lumbar vertebrae. You saw that in a previous image. Then the sacrum, and then coccygeal vertebrae. So you have 7 cervical vertebrae, and these are the vertebrae of the neck. Then thoracic then are the vertebrae of the middle back, and then the lower back, lumbar vertebrae, which you saw in a previous image. So now we're at the phalanges. So the phalanges are the most distal bones of the wrist/hand. So they are distal, immediately distal to the metacarpals. They're the phalanges. In this case, we're talking about the phalanges of the foot, however. So these are distal, in this case, to the metatarsals. There's the sacrum. These are 5 fused vertebrae that make up the sacrum. So the sacrum are inferior to the lumbar vertebrae, but superior to the coccygeal vertebrae. There's the breastbone attached to the clavicle. In this case, that's the right clavicle. So the sternum, commonly known as the breastbone, and we have various components there. You can see that laterally the ribs attach to the sternum along its lateral side. The sternum actually has 3 distinct components called manubrium, body, and xiphoid process, and you're seeing all those in this picture. So sternum, and then the right clavicle is attached to the superior part of the sternum. There's the hyoid bone, the kind of a funny looking bone and a funny bone in general. It doesn't really articulate directly with any other bone, but it provides attachment for some muscles that we use to facilitate swallowing. 24, we got one more to go here. You're almost to the end. 24, and again, a lateral view of the skull, but in this case, we're taking a look at a cranial bone. The previous image had labeled a facial bone, the mandible. Now we're looking at a cranial bone. Remember, these are the bones that surround the brain, protect the brain. Last label here for this little picture quiz. The red square is labeling tarsal bones. So there are 7 total tarsal bones in the foot. And remember, these are proximal to the metatarsals. And then we have phalanges, of course, the most distal aspect of the foot here. So that's your final label. So if you need more help, you need more resources, come find me at Anatomy on the Go and feel free to connect with me. Also on my website, I have 25 hints and tips for learning anatomy. It's all free. And then I have labels of the entire skeleton. So if you want more detail beyond what you found in the YouTube mini course, feel free to find me over there. And all the components are labeled, except for some components on the skull that aren't labeled. But feel free to head over and find me, connect with me if you need more help, or if you have something you'd like me to podcast about, or a question you'd like to ask me, you can find me there. Thanks, and stay tuned for another type of quiz that I'll post on YouTube as well.